and then we'll post the recording online like we always do. Um, and having said that, I think I'll turn it over to John, who has the agenda, or Obi.
Did you have some things you wanted to share at the beginning, Dr. Michelle, about where, like, just a global perspective of this movement, and give us some updates or some thoughts on from your perspective?
Yeah, absolutely. So I think I sent a message to everybody yesterday about how important I think this group is going to be, as far as, I mean, as we're seeing now uh, with the reopening of certain parts of the country, and the fact that not all of it is following what the CDC guidelines are. That obviously there's a lot of pressure to reopen, and I think it's more important than ever, a group like this, because this is the group of people that will eventually make it safe to and make sure that we have the virus under control to reopen. So I encourage you. I don't know if you saw my message, but so this virus can multiply from one person to three people. So if you can each get three people, and each of those three people can get three people, we can get to the point where we can get to the numbers that we need in order to really deal with this, especially if everybody starts taking the course and get some of the training. So I really encourage you to do that. There's nothing more important than contact tracing. The only other thing that's more important is testing, and we individually can do very little about that, because the testing is controlled at the government level, and so whether supplies are available or swabs are available are things that are beyond our control. But what we can do is, spend time with contact tracing and make a big difference, and hopefully be ready to safely reopen and controlling the spread of the virus. I'm sure some of you may have seen the reports this morning on how Wuhan already has 5 new cases, and it's coming back in South Korea. So this is not going to go away anytime soon, and so we need to be ready for it, and we need to contact tracing is the best way to do that. So that's
Yeah,
all I have to say.
the other thing is that once that ratio 1 to 3, or the R naught's going to change once the virus mutates. Once the second wave occurs, it's going to be 1 to 1 historically. So stuff's about to get real.
Yeah, and I can tell you from our experience at the hospital, at this point, we started with occasional people with pulmonary illness, and as of now, about 70% of all of our inpatients are COVID positive, or are in the hospital because they're COVID positive, or because they have symptoms. We don't have as many people on ventilators because we've been very aggressive with the use of plasma and other modalities. But I anticipate that before June, every patient in the hospital will be there for COVID, which is what happened in New York and what's going to happen here. So we need to get ready for that.
Dr. Michelle, a quick question.
Sure.
What do we suggest to the people around us? Like, everyone's been so tired of being at home, and now that they're actually lifting the lockdown. So about people meeting up and about having small gatherings. What do we say? What is the practical
It's a tough thing. I'll give you an example. I mean, yesterday my wife hadn't seen her family for a long time, and she wanted to do something for Mother's Day, and I made everybody wear a mask. Okay. So everybody that came in the house had a mask. Everybody had to wear a mask, and I still don't feel that it was safe. But but what people do, they'll start taking off the mask, and they start, so nobody said hello. A couple of my brothers-in-law tried to shake my hand. I said, "We're not shaking hands. Wash your hands." But that's the thing is, and keeping the social distancing is difficult, especially for elderly people. Like, we had my mother here, my mother-in-law, and they're trying to get close to each other, and I'm separating them. When we had dinner, we had different tables with people that live together, as opposed to having everybody in one table. But there are things you can do. Obviously, the safest thing would have been to do it via Zoom, but my wife would have divorced me for that. But so I decided I didn't want a divorce. So, but she hadn't seen her parents in a long time. So there are things that you can do that are smart things that can keep. Now, I don't know. I mean, the outcome we'll know in the next 14 days
Yeah.
if somebody, because everybody's like, oh, I feel great. I don't need to wear a mask.
Yeah.
We're like, I know.
Yeah.
We don't know 100% because everybody that, a lot of them are still working and they're interacting with people. They could be in the phase where they're contagious, but they don't have symptoms. So yeah, what I think, unfortunately, what they're hearing from government is that, or politicians, I shouldn't say government, but some politicians are trying to minimize it, and I think that's very, very dangerous.
Well, you should see Georgia. Because they minimized it, 50% now is 50% of the population in Atlanta and the surrounding metro Atlanta is not wearing masks now. They're just not.
Well,
they're
you go, if you see the traffic here, I mean, it looks like a normal day. People are going in, people are out and about, and they're everywhere. I should say that at least the supermarkets are making people wear masks, and they're telling you if you don't wear a mask, they send you back out. But a lot of places people are just going like nothing's happening, and that's the dangerous thing about all this. It's
well,
not
that's
a
all.
political issue.
That's why you're going to see all of your population in your hospital are all going to be positive. For that reason, it's going to drive that right to that.
Yeah, it's unfortunate, but that's what's happening. And Latin America
Do
is even
some
worse.
herd immunity, hopefully.
Well, you saw my graph about what herd immunity means, right? I mean, it's how many deaths are you willing to take, And I can tell you, I got a call yesterday from my I have an aunt that lives in Colombia in Barranquilla, which is towards the coast, and so the person that was her neighbor called me and she said, your aunt, she has some viral stuff, she has some diarrhea, and by the way, she died this morning. And I said, wait, why didn't anybody call me? He says, well, we were going to call you, but it was just a little cold, and but it's not COVID. It's not COVID. So I said, how do you know it's not COVID? And she said, well, because everybody in the building had it. It's cold diarrhea and a little cold. So I said, it's COVID. What else is it? So they said, well, so I said, did they test her? I said, no, the protocol here is they send them straight to either the crematorium or the funeral home. There's no testing. Because of course the government doesn't want to have all these positive numbers. So that's, and I don't know if you guys remember when our president, with the Princess Cruise line, the Princess Cruise that had all the 13 people that died, and he didn't want them to be added to the United States numbers. And you still can go, if you still go on COVID, coronavirus statistics, you will see that there's a line that says Princess Cruises, as if there was a country. So you see all the countries, and there's one entry that says Princess Cruises, and it has 13 deaths, right? Because he didn't want those 13 deaths to be on the United States. And now you go look at the United States, it's 80,000 deaths. So those 13 probably made no difference. But this is what's happening in every single country, is that the leaders are basically doing a very big effort and making sure that they're not reported as COVID deaths. So they're just saying people are dying because of natural reasons. So anyway, it's crazy. I've been having arguments with with people that don't believe it. Like one of the arguments I get from some of my friends back in Colombia is, oh, the hospitals are empty. There's nobody in ICU. So I give him that article from the New York Times that showed that 1,200 people were found dead in the period of 5 days in New York City. Those people didn't go to the hospital. They were in ICU. They were found dead, and they probably had COVID. What else did they have? Other than why would 1,200 people die in 5 days in New York City if it wasn't for COVID? But be found dead at home or in a park. But people still are in denial, and when you hear politicians telling them what they want to hear, it's very comforting that it's all going to be better, and nothing's happening.
Well,
anyway.
the other thing is people who don't have family members or friends who died and own small businesses, which seems to be, for whatever reason, a disproportionate amount of number, is that they're the ones who be like, look, we need to open this thing up, and the cure is worse than whatever that phrase that they say that's so stupid. But the fact that these people want to rush to open, but patrons are not going, which is a good thing, you know, in most states. So, but it'll happen. They're very gun ho on getting open and getting money
Yeah.
back, which is fine, but at what cost?
I see something from Claire about that Channel 7, the person in Margate. I got a text about that Saturday night. There was no way to get a hold of anybody. Finally, one of our doctors got a hold of the CEO. On Sunday, they started saying that the person had a pre-existing condition, namely diabetes, even though he's 45 years old. And that precluded him from getting plasma, which, by the way, it's total hogwash.
Yeah,
Because
totally.
if you have no risks, why would you be intubated in ICU? A 45-year-old probably wouldn't be, and that's the only reason he was there is because he's obese and he was diabetic. So they said that it wasn't indicated, but I believe that at the end of the day yesterday, he may have gotten the plasma, because I think we started offering it, and the hospital kind of like perked up and decided to give it to him after he's been in ICU for like a couple of weeks, which makes no sense. But
There's no provider or healthcare staff that is. It's funny how that's another disproportion. It's everybody in healthcare is saying this is the worst thing ever, but everybody outside of that, it just shows this because of our leadership in the federally. It leaves a lot of ability for people to create these.
well,
One thing in emerging threats,
yeah,
you have to pay attention to every rumor, because
Right.
that also factors in.
And just to say, this is one of the reasons why we started the plasma study, because we were kind of just giving it to people early, and we started realizing that it's not. Yes, we can save a few hundred people that way, but if you want to save thousands of people, it has to be the standard of care in the United States. And in order for that to happen, you have to have a study. And in that study, there are going to be people that are not going to get it. This is part of having a randomized trial. Like the Mayo Clinic doesn't have a randomized trial. They just kind of give it to people that are really, really sick and about to die. But we
Right.
want to do a study in 23 hours. But unfortunately, we're going to have people that are randomized not to get it.
Yeah,
Because
it's a
we need to
prospective.
show that it makes a difference. And it's a tough
It's a
thing to do.
prospective.
So, Dr. Jack, is there anything else that you'd like to share with us?
I'm good. Go ahead.
Okay,
Yeah, go ahead.
great. All right. Thanks again. Thanks so much for everybody being here. And also for all of your the practices and your comments from last week. They were very helpful, and I know that it kept Camilo very busy as he was working on improving from your comments. Today, we're going to do some more. We're going to do a similar activity this week, but first we're going to go over the app again, and we're going to be looking at the questionnaire aspect. And what we're going to have you do is that this week we'll do the same thing. Half of you will be patients for 2 days, and half will be the CTS, and we'll switch halfway through because we want to do the 2 days of reporting just to ensure that we have got all of the kinks worked out. So, and I just wanted to share also, there's a lot going on that that you all are not aware of just because it's stuff behind the scenes, but we're trying to work out even just the workflow of all of the information and the data management. So when a patient signs up, what happens with that patient? We're walking all the way through every step so that we don't lose them, and that we know where they are in our system, and that we've got that covered. So we're working on our workflow and data management. We have Dr. Kunal, who is actually working with us from Mumbai, India. He's doing a lot of the social media stuff. He's made some great posters for various social media platforms. He's also going to be helping us take some of our specific documents, like we just put together a script this weekend, and he's going to be putting that into a form that is more pleasing to the eye. Right now, and you will get it today, the script is in Word, as a Word document, but we want to make it so that it's we're creating a theme and colors and fonts that reflect who we are. So the IT team is working on that. I'm sorry, the social media team. So a lot's going on in the background as you guys practice and give us your comments, which we greatly appreciate. What I'm going to do now is I'm going to share my screen, and we're going to go through the COVID app again, so that you all can see our updates and see the questionnaire and see how that works. Okay. Any questions about that? Okay, so this is at the beginning where you sign up, and we'll just click into here. We've made we've tried to also clean up the language so that it is more clear as to what people need to do and the information that's on here. So here, I'll put in my information.
John,
Yes.
you're still on the previous version.
Oh, okay. What do I need to do? Shall I just go out of this and start it up again?
I believe on my side it's the new version, but I guess for some reason
Okay,
you still have the old version.
then why don't you do your screen, okay?
Okay.
And while he's doing that, John, people are asking in the chat room about assignments. And I'm telling them that at the end of this meeting,
Yeah.
assignments will be made like Camilo did last time, where he'll just divide it up.
Yes.
So if everybody will just be patient and wait till this is all over, then the assignments will be made and the testing be done, right?
Right, and actually, thank you, Virginia, for that, because I just wanted to say also, if you do have questions throughout the presentation, what would be really helpful, and we'll pause at different sections, if you would send your questions to the chat, and then Dr. Rana, can you just let us know when you have some questions, and we can go from there. That would be really helpful. Thanks, Virginia, for that reminder.
Yeah, Dr. John Capel, I just want to interject a little bit. This is Obi, by the way. I wanted to equally tell everybody that tomorrow we still have meeting, scheduled at this time for regions 1 to 5. We want to have smaller units where people, and very safe space where people could interact, moderated by their regional heads. And so whatever questions are left over from today, we could continue tomorrow. But that will be for regions 1 to 5. On Wednesday, at the same time, it will be for regions 6 to 10. So no judgment at this point. Just feel free. We're all in this together. Thank you.
Great. Okay.
John, close the app out and just open it from a new browser.
Oh, okay. All right.
Open it fresh. Yes.
Okay, hang on a second. I got this. I'm a little bit on this. Okay. COVID Finder.
There, that's the newer version.
Okay. Is my screen shared then now? Is it?
Yes.
Okay, great. All right. So let's see how this goes. Hang on. Let me move this down so I can see everything. Just so you know, we have gone through this. There's still some things on the app that we haven't filled out yet, but we will be getting to that. So like here in the about, I guess I have to sign up first. Okay, here we go. And then, they just, the same as before, just click through these. I think that we made these simpler to use.
So, by the way, everybody, it's picking up his email because he's done this so many times that it's automatically picked up his email address and it already knows who he is. It automatically logged him in.
So I clicked it. I have symptoms, and I've got these two. And then see, we have here now, he's got continue. So instead of it was save, this is continue, so that people know that there's more going on. Now I put my, send verification code. So now people really, they understand what's going to happen. And Camilo, I don't have to erase these zeros, right? They're just going to disappear?
Correct.
Okay. Oops. So then this brings me to the, so over here, if we put edit over here, we didn't have words before. It was just the pencil. So now people know that they can edit here. Okay, so then again, same with here. They can go in and edit their, put their address in.
I believe I made it only the zip code is mandatory.
So again, we put things in here so that people, it's reminded if whether they've done this or not. So that's not complete. They can go over here and edit it if they want. And then we come down here. These are the questions for the that you'll be asking the patients. And again, we have it here where it's you know whether they need to fill this out or not. So when did these begin? When did you first suspect you might be infected? Put a date here.
John, I think there was a word missing on the one before that.
On these dates, you can actually pop out the calendar. There should be a little icon on the side, but since you're typing right now, it's not showing.
Okay. No, I don't. Let's see, reset. Nope, it's not there.
Oh, okay, so I made these free text. I should make those dates.
Okay, so you're gonna put that in there?
Yes.
So look at the question, when did your first begin? When did
Okay,
your
yeah.
symptoms first begin?
Did you get that, Camilo?
Yes, I believe we made that typo, right? Recently.
Okay. What were your symptoms? We have currently 4 listed here. It's been suggested that there could be put more, but for right now we have 4. So just use those, and you can see that it comes up as complete. Including yourself, how many people live in your household?
Sorry to interject. Camilo, I know we have 4. We should have another box where it says others, somewhere there. Because it might be.
But the problem with that is then you have to have a drop down if we want others.
Yeah, if we have to put that because it's beyond those 4, we have to make that change.
Well, we want to have specific ones that are only related to COVID. We don't want to say other because we don't want them, oh, my foot is sore. I mean,
yeah, we need that information if their foot is sore. That's no problem. The neurologist will take care of that. We need an additional box because the symptoms kept evolving. And there are people that just have what's called loss of taste or smell. So we need that additional box.
Okay. How many people live in your household, including yourself? So this comes up so you can be reading it after you've put it in there. Has everybody in your household been tested? It's a yes or no. Please identify, and this is where you will be collecting information. Please identify all of the people you have been in close physical contact with or shared confined space, less than 6 feet apart, for more than 15 minutes over the past 14 days prior to experiencing COVID positive symptoms. And then this is a drop-down box where they can list everybody. And as we list people, I'll save that. And then it actually lists it out here. So you'll be able to see the data as you put it in.
And you can add as many as you want by just continuing to hit the edit button.
That's the idea. That's, we need to, and that's something that needs to be more tested, but yes.
John, can you guys can use the same Dropbox for the symptoms, because it's really important. For example, the person that I told you about, he has COVID and he has 2 symptoms that is not here. So a lot of people will get confused, like, okay, should I, do this contact tracing because I don't have any symptoms that they describe over there. So
Okay.
I don't know. It's complicated with the symptoms right now because some people have mild, some people has fever.
Okay, we'll look up the most recent list and add the symptoms that need to be on there. Thanks for that comment. Please identify all of the places you have visited for more than 15 minutes over the past 14 days prior to experiencing COVID positive symptoms. And here you put down the location. So I went to the barber shop. And if I know the person, put it down. They don't have to. This just, it makes it easier. And the phone number and the date that you were there. And we had this, I don't think we need this category here because we're just really looking, that was just to help them think through. We can get rid of that. And then that also gets saved. And Camila, these are not lining up. Is there a reason why they're not lining up?
I just have to edit it. to
Okay.
make sure the flow goes through. Right now the data is just showing like that. I'm sorry.
Okay.
And
Great.
John, just so it's clear, the point of this is that each of the people that they list as a contact, you as a CTS are going to be contacting that person, and same with the location. You're going to be calling the location saying, by the way, this COVID positive person was in your whatever on this date. Because they are very well going to ask you, why do you need this information? And that's the whole point of this.
Right. So
Can
there's,
I, John?
yeah.
Hey, it's Dr. Sean. So I'm just going to throw this in there. We'll hit it this week or next week. But again, if something is related to a mushroom event, like a mushroom cloud event, where it's something that's a mass casualty, that case should be deferred to myself so that I can handle the logistics of say, for example, I know this is hypothetical, but like a baseball game or outing or a funeral that has a lot of people. Just have them divert that to me.
Okay, I think that for that, Sean, that'll be part of the protocols that you're pulling together. For the purposes right now, we just want to see if this is working. And so for those sort of details, we will include those in future trainings for if this happens, then contact this person. So, but thanks.
Understood.
Yeah.
Yeah, and just so everybody knows, we're trying to do this in form and substance. And what John's going through and Camilla is going through is all the form of how we do things. And then Sean's putting together a manual on the substantive questions and answers that we as CTSs will be giving the patients.
Thank you.
Okay.
Yeah. So this is where we're asking for their COVID-19 positive test result. This is something you can have them, take a photo of their test result and put it up here so that we have that. Then we have here, just at the end of your interview, remind them about they have the potential to donate their plasma. And we didn't get this spelled correctly. Opportunity is not spelled correctly, Camilla. We need to change that. And we're also changing this, the plasma donation question. It's a little bit odd that it's here an asterisk, but we want them, they get 3 options. Do they request more information, no, or yes? So we're going to consider putting 3 buttons down there so that they can just click a button. So we're trying to see if that will work or not with what Camilla has set up. Because if they say yes, or they want more information, this information will be sent to the plasma donation team on the larger team Larkin, and they will contact them. And the same for the peer support. If they want emotional support, we're not promising any kind of medical support or support for social needs, but we can provide some emotional support through our peer support team. The same thing happens here. They can request more information, no or yes, and that information will be sent to the peer support team. And lastly, we just extend them the opportunity, if they want to become a CTS, they can request information.
Can anybody hear me?
Sure, yeah.
Yeah.
My question was, how do they take their certificate that shows their test results and put it on this form?
Well, that's where they need to be, hopefully can be savvy enough and take a picture on their phone. If not, they can, that's the only way I know how to do it. Does anybody else have any other thoughts on that? So we need to work through that. So this will be a great thing. If you are working with, when you're being interviewed this week, can you try to see what works? See if you can take a picture of anything. It doesn't matter. Just take a picture of something and see if you can get it posted for us.
Is there an email address that we could put for that, so that on the app, as Nancy Jo says, if they are unable to unload it into the app, can they we have another option where they can email it to, and the CTSs have access to that?
Camilla, is that possible? Can we put like if they don't have something, can they send the proof to someplace?
We can send it to an email and just upload it every time we get an email. Upload it to a Google Doc.
Okay.
And
can we have it sent to the CTS and they can get it onto the patient's?
They can upload it themselves.
Yeah.
Yeah, the CTS could log into any user's page that they have access to.
Okay, so can you put here, if on submit proof, maybe the better thing to do is just have an email address here, submit, have them submit the proof to the email, and then it gets uploaded.
I think you're talking two different things. Camillo's saying that that the CTS, you're saying Camillo uploads it if the person provides it to them. We're saying, is there a box they can put it in? So if the CTS is working with them on the app and they say, yeah, I have this proof, but I don't know how to get it into this app, what does the CTS do, Camilla?
Okay, if the person cannot upload it themselves, the agent can always upload it for them.
So Camilo, is this a required, is it required, the submit proof is not required, or is it? Is it a required
It's
function?
not required to become a patient, no.
Okay, but I get the point that they're probably trying to make. Can we leave a comment like, you don't have the proof or can submit the proof, no problem, send an email to Dash, what kind of email later, with the proof. I don't know if that's, but we could find the right language. You're just there. I think that might cover that aspect.
But actually, Obi, I think you bring up a good question. Do we need to have proof? I mean, is somebody who's not positive is probably not going to go through this. Do we need, if we have the date and location of their test, do we need to have proof?
I think, just for, well, that would be Dr. Sean's question, data and submitting to CDC and other government that might need it later, we need those, not just saying that, oh, I did this test, I'm positive, but if there's a confirmation somewhere that we have in our database, we could probably submit that, but that will be for later.
Can the CTS have the email right here so they can send the proof or of the test, if it's positive or to the CTS, so we keep a record of each of the patients, you know, that upload the test and then send it to the, I don't know, to the main email?
Well,
I
yeah,
have a suggestion.
I don't understand why we would use an unsecure method when we already have a secure method with the positive.
I have one more suggestion. Like like if someone cannot submit the proof on this app, can we say them, or can we add an option like submit it to your PCP? Because I think that is more secure instead of giving to CTS, because the CTS are spread all over the states. So instead of giving to CTS.
Good point, Camilo. I think you raise a very important point with respect to confidentiality.
Yeah, I'm saying because it's a very important thing in case for a patient. We don't want, because we have to take care of the HIPAA and you know, so that's what I'm saying.
Yeah, I mean with the CPC, I mean it's a different. I think Dr. Sean is going to show us the algorithm later. But Camilo, that's a very important point. We need to make sure everything is secured. So I think
everything
unsecured email might not work here. So yeah, thank you.
I mean, it has to be secure in the sense of HIPAA too. I mean, so.
Yeah.
So how about if we practice this week? If we practice this week with the CTSs and the patients, and a patient says, "I don't know how to upload this," and the CTS talks them through how to put it on the app.
Yeah.
Because if they're going to email it, they've still got to be able to take a picture of it, put it on their email. So if they can just be told how to put it on the app.
That's a good point.
CTS has to share their phone numbers with the patient, because in the prior meeting we were discussing, right, that the CTS phone numbers will be hidden from the patients. That's what I remember we were talking in the last meeting.
Correct.
Yeah, even if the phone number is hidden, I mean, you could talk through, it's more like an instruction. You could talk them through it. I mean, I've seen situation, I don't know how elaborate we're going to be going, where you could even share screen with, the user and say, okay, this is where you're going to go and click and upload it. So even if you don't have their phone number, you could still guide them, well, depending on the platform we're using, to make sure they upload this information. But like Camilo said, we need a secure portal for that.
Yeah, and Dr. Obi, that's what I said. Okay, Dr. Obi, I have one more suggestion. That how about a virtual assistants? Like instead of sharing our own phone numbers, we can make a chat box in the app, and they can contact with us like with chatting. How about that?
Yeah. Camilo?
I agree that is definitely the progression that I see this going to. A chat box where you get to chat with your agents.
Yeah, and we can assist them in uploading on this current option, or either we can go for the thing I was talking about, like PCP. So like,
I think
this is more secure, I guess.
Let me just say, this is sounding really difficult. And if we're working with, especially older people, this is going to throw them. If, talk about chat boxes so if it's difficult, we need to really think through, do we have
Let me interject, please. When it comes to the special population, when it comes to the mentally challenged and the geriatric, I already put in a request for advisement from the CDC. So I should expect that email back in about a week. I'm going to push for it to come back earlier by just calling the line. It's a technique we used to use, but I'm going to get something that specifically deals with that situation. So I don't want anyone to worry about that, like elderly, special needs. Like when I talked to Barbara, or Barbara suggested that last week, I jumped on that because it's going to be a big problem if we don't address it. And I'm going to address it, and I'll get it taken care of. I'll put it in the manual.
Right. And so I think that for the purpose of this, when you're the patient, when you get to this, say that you don't know how to do it, and let's see what solutions you come up with, or if it's just too complicated, we need to really revisit this portion of the questionnaire.
It won't be too complicated. When in doubt, it'll come to me and I'll fix it.
Yeah, it won't be too complicated. I think Camilo should take note on this, because it's very important that was raised. It won't be too complicated for the every other person that knows how to use the phone to chat. That won't be. But the special population, I will allow Dr. Sean to work it out.
For the special population, it will be based on protocol, Dr.
Right.
Sean. So those people will be receiving a call, and the agent will most likely be getting those documents in another
Okay.
way from the person.
So Camilo, what I'm going to do when I get to Miami, we're going to just go, I'm going to spend a day with you if you got a day, and we're going to go through all of this, and I'll answer all your questions and get and then update the protocol as we do that. All right. If you have it this week.
Okay.
Yes.
Great, super. Are there any other questions about the app and how it's going to be functioning? And this is really the portion of this app is talking with the COVID positive person, and the next portion of being a contact tracer is then you'll need to be contacting the contacts that they list. But we're saving that for another training session. But for now, are there any questions on how this operates?
So Dr. Van Kapel, a couple of people asked if this is a new app. So I told them this is the updated version, right? And they will have, because they asked if they would have to sign in again.
Camilo, what's your?
I saved the email list so they can sign in with their email.
Okay.
But it will force the welcome screen on them again, and it will make them go through all of the experience again.
Okay,
Except
so
for creating the account.
so they will have to register again.
You do not have to register again if you've registered already.
All right. And there was a suggestion for adding more sign-in symptoms. I'm going to go through everything. So.
Great. Okay, super.
Okay.
Okay.
Then there was, yeah, go ahead, sir.
No, go ahead. Are there other questions?
Yeah, and then someone was asking if all the things with the asterisks are mandatory.
Yes, are there asterisks in particular that they were asking about? These two down here, those will be taken off. The asterisks on the plasma donation and peer support will be taken off. But are there some asterisks?
I asked the question regarding the contacts that they've had. Shouldn't those questions that are mandatory be asterisked so that we can get the information needed to contact the contacts?
So you're talking about all of this. So you're saying you think to asterisk those?
Yeah, asterisks. You know, like maybe we need the phone. We don't necessarily need the email, but we need one. We need the name, of course. The relationship, maybe not, but we need an email or a phone. One or the other. Or asterisk everything. But
Yeah, I think we need it all. So
but there's CTS at the back end. We want this to be user friendly. We want to start a conversation and continue, because if someone can move forward without providing that information, some people might just back down. So they could provide as much as they can. There's someone that's going to be at the back end that's going to be following up, either via text or call.
Camilo, just on this box here, remember to take off this new family member section. Okay, are there other questions?
Okay, so there's someone asking, in case of minors, do we record parents or caretakers as the patient's responder?
That's a good question. That's a Sean question.
Can you repeat the question, please?
In case of minors, do we record parents or caretakers as the patient's responder?
Yes, there has to be, when you're dealing with anyone under 18, you have to mention, you just have to mention it. That because in this case, in these scenarios, when there's crises like this, the public health will allow us to ask the question, but we have to give a disclaimer up front, go something to the effect of, you know, because you're 18, we request that you make your parents aware we're speaking to you. So like a 17-year-old doesn't need to go through such an extreme thing. As long as we can get somebody to acknowledge it, we're fine. So
Yeah, in addition to that, I mean, there's that proxy, the proxy,
Yeah.
or giving someone else a right to speak on your behalf. I think
Well,
Sean
yeah.
might modify that and add that part of our guide. Yeah.
That'll be in the guideline addressing minors. It'll be very straightforward, and as long as you have somebody verbal consent, even if the patient under 18 got a family member in the background who is 18, like a sibling, that's enough, because it's their responsibility to take that information and bring it to their unless they're an emancipated minor. That's the only weird thing, but that'll be in the protocol. Go ahead.
Okay, super, great.
Okay, Dr. Van Kapel, if a patient does not answer all the questions, will they be prompted to complete the app questions?
Well, if they don't answer them, they won't get this complete. It'll say it won't say complete.
But will they be prompted to complete the questions somehow, like?
Well, it'll be red. It won't be green. And as you can see, there's not that many questions. There's like 6 questions here. So
This is a tool for the contact tracer to get data in advance from their contact. So
Yeah, that's not complicated. We'll manage that one. I think we should move to the next topic.
Okay.
John, are we gonna contact the PUIs? We're gonna contact with our phones, or what are we gonna do about?
yeah, at this point, you'll have to use your own phones. Yes.
Awesome. Okay.
All right. Are there any other questions? I think that's about it from the question section.
Camilo, can you update this is Dr. Sean. Can you update my my new COVID phone, the number, the 470, so that people can contact me if they need me on that number?
When you log into the app, you're gonna be prompted to.
Okay. All right. That's fine. Thanks.
Camilo, Arshi Sana is saying that he filled out everything the 3rd time. What do you have to say about that?
That this is the 3rd time they're signing up. I'm sorry.
Yeah.
Sorry guys, I didn't make you create the whole account and go through the email verification process. But I do want you go through the whole experience and just let me know any detail. Just send me an email, write a review, write any comments, any improvement you might find. And if you send it to my email, even though now that we're going fast, I will take a look at it and I will consider it in depth.
All right. Thank you, Camilo. That's it, Dr. Van Kapel.
Okay, great. The next thing we want to do is because, and this is going to help you understand how this is going to work. And again, we're still working out the workflows. So from the moment that a patient comes to us, how does this work through? And what we've realized, the first batch of patients, they're all coming from Larkin Hospital. And so they're not, in the future, we hope that people are going to find this on the app and they will self-enroll. And that's how we will get a notice that we have a new patient. For this, as we start out, the CTSs will be contacting the COVID positive patients after they receive a letter from Dr. Michelle explaining this opportunity to participate. But they may or may not have signed up yet for the app. So this is a script that I've put together, and I'm going to put it on here when we're done. But also, it's going to be available so that you can download it into your materials. But it's also going to be available in the contact tracer resource, which you'll be able to find on your on the dashboard. So this is coming to you. I just want to walk it through. This is a script you can use to engage with the COVID positive patient. So first of all, be sure that you have their first and last name. And this is what you'll need to know is what is the origin of the patient? These are for now and until we start getting patients that come off of the web or come off of the app. They're all patients that may not be familiar with the COVID Fighter app. So you'll have to give some introduction to the COVID Fighter app with them. Does that make sense to y'all? Okay, so anyway, it's very simple. In the introduction, tell them your name. Let them know that you're calling from the Larkin Community Hospital COVID-19 response team. So that gives us some credibility that we are with a hospital and the hospital that they actually got their test from, and that we're the COVID-19 response team. And then confirm that you are talking with the name of the patient.
John, excuse me. Let's say that somebody knows that you're already a CTS and they need help. Maybe they went to the clinic, they test positive, and they need help. Can we include it on Larkin?
What kind of help? What do you mean?
To contact trace them. Like for example, when I mentioned that I have this person on my family.
Yeah,
and he tests positive, but he's not doing. Nobody's following up, and nobody's doing. Nobody's helping.
Yeah.
So can we include it in the Larkin?
Yeah, I think that I'm sure they can. They can. I would imagine they can just sign up on the app, and that will go through Camilo, and they'll get assigned to CTS.
Okay. Okay.
So that's because there's two ways. Remember to get on this. One is we will be contacting people from Larkin, but we in the future we want people from anywhere to be able to contact us. So when this is on as an app, either on Google or Apple, that's one way people will find out about us. Or as they hear about this, they can just go on the web and look for COVID Fighter app and sign up. So those are two ways to sign in. And if they've already signed in, your introduction will be a little bit different because they're already familiar with the app. This first one, these people are not going to be familiar with the app probably.
Okay, Dr. Van Kapel, this is Obi. So I wanted to quickly just tell everyone that we're still working with Dr. Van Kapel and Dr. Rana. We're going to be having, subsequent sections on where we talk about emotional intelligence, cultural humility, because it's not going to be a walk in the park. So we're going to be sometimes, encountering people going through difficult time, right? And they might not respond to us the way we want to be responded to. And considering the fact that some of us are international medical graduates, some people don't have US experience, we're still going to have a session where we talk through all those things and, in terms of how to interview, build rapport, handle difficult situation, do some health coaching. So we're going to create a safe, non-judgmental space for us to, practice, divide ourselves into groups, practice with one another, and get better in the process. So, but that will be, when we're done with this webinar series 1.0, we're going to get to webinar series 2.0. Thank you, Dr. John.
Yeah, thank you. So continuing with this, so you want to, again, part of beginning to show some empathy with them and to be sure that you're being courteous, ask them, is this a good time to talk? So that they have the option to say, no, call me later. But so you want them to understand that you're thinking of them. You're not just here to get information. So this helps to let them know that you're empathetic with them. Then you'll want to confirm that they have been tested positive, and be sure that if you will have on these the date and time, the place of testing. So confirm that with them. And then confirm that they got the letter and have they read it. Maybe they don't have any idea what you're talking about. So you want to be sure that you're on somewhat the same page there. And then these other questions, you can certainly feel free to ask them how they're feeling. Ask them what the symptoms they currently have. And then you ask them, are you able to isolate while you have these symptoms? One of the problems with asking these questions, it sort of can take you down an area that don't want to go, nor are we equipped to go. But again, we're trying to show, you know, some empathy with them and some compassion. And so if they say something like, you know, they can't be isolated, that's where we need to come up with, well, what's our response to that? You know, we need to help them think of resources that they have in their communities to help them.
That was my next question. Do we remove from the app about the support, you know, whatever support we can give about, let's say, food or help them isolate, or we take it out of the app already?
We took that off because we can't provide that, right?
But we can do it. We can do it. Let's say, for example, the patient that I have, for example, not the patient that I have, the family member, and they were asking me, you know, if there is any way the city can provide them for food, for example. So I gave them the phone number, and then, you know, they get it already. So can you do it on the side?
It should be directing the app. We should be able to say to them, please look at the app under provincial services or something like that, and just refer them to the app, to the area where it says, here's a list of food banks, here's a list of things, or numbers nationally like Red Cross. They can call there and find out where they'll direct them to all that, because Red Cross does do that. So
yeah, we need to remember that we're really detectives here.
That's it.
And
that's it.
If we can refer them, that would be great. So it would be helpful for regional heads when you start getting people in your region, if you did have a list of resources for them that you could refer them to, that would be really helpful.
I think with this person that I'm following, the main concern is that, like, how I don't have energy to cook, how I'm gonna go outside and buy food. I can go outside. So actually, for example, here in Miami, the city is actually bringing you the food to your door, you know, and that's really helpful for them. It's kind of like a support and showing that we actually care, you know, from my point of view. And how about somebody ask you, somebody say that they cannot be isolated because they live, let's say, in a house with one room and they like 3 people inside. What we should do about it? Like, because they really need to be away from this person, but they're actually in the same house, you know.
Well, I think we need to encourage them to find ways to be isolated, because just remind them that that's what is going to help keep other people from getting infected.
And reminder, that's going to be part of the substantive training that Sean's going to do.
That's correct. I'll have that all in there. Plus, I might do a video tutorial for trackers.
Say, if you're not talking, if you're not speaking, can you put yourself on mute, please? We're getting some feedback. So the next line here, and this is really important, to let them know that you're not calling as a medical profession. That you're not there to offer them medical advice, but to check in on them and to offer them support and orient them to the COVID Fighter app. So really be clear on what your role is and clear on what your role isn't. And those things will be coming later, but we wanted to get a script out to you so that you can start engaging with patients.
Dr. Venkapal, there are a couple of people asking, how do the people who are not at Larkins, how will they find out about the app?
Good question. That's why we need to be doing some marketing about that. So that's going to be, again, we can do some social media stuff. Maybe we can get some mass media information once we get more. It's on people might stumble upon it once it's approved by Google or Apple.
Also, can I remind you that we have, Larkin obviously has access to the health department records that show the people who are positive, and so we're going to try to reach out to them, but we want to get through the people that have come through our testing sites first, which are about 1,000, and test all this and make sure it works before we start doing a broader recruitment for patients. And so, but we do have ways to do that through the health department records.
All right. Thank you, Virginia. That's awesome.
So then ask them if they've had a chance to sign up for the COVID Fighter app. And if they have, just find out how far they've gotten and ask if you can review it with them and see if they need help with it. You know, we're going to have some people that they don't need any help with this. They can just fill it out and they really don't want any help. If it was me, I just want to do it on my own. I'm not feeling well. Yes, I understand the importance of this, but I really don't want somebody asking me the questions. I can do it. So I would do it on my own. But if they say no, first of all, be sure that they have access to a computer and then help them access the app and sign in. So, and I was just on the phone this morning with Camilo and with Orlando, because again, as I mentioned to you all, we're working through the workflow and the data management here. So we want to be sure that the patient, if they haven't signed up yet, that when they do sign up, they're immediately they're immediately approved. They don't have to go through signing in and then waiting for the CTS to approve them. And we have figured out a way we think is going to work where the names of the people on the list that we're going to be contacting, they will already be pre-approved. If we have their email, we can pre-approve them so that if they've not started working on the app, you can start walking them through it immediately.
And John, you don't mean that if they don't have a computer, they can't do this. They can sign up completely on their phone, right?
Oh yeah, I'm sorry. I should say computer or phone. Sorry.
I'll have a resource too for patients who don't have access to the internet. So in the manual for the contact tracers, I'll put it in there.
So the other thing that you might come up against, and we obviously this will be part of the thing that, we'll be working with Sean on developing, is what if they say, I don't want the app, or let me think about it. How many chances do we call back in 3 days? Or so that's one step that we haven't.
I think in the CDC guideline we have it, so I'll put it in the thing too. I think it's 3 days.
So then after all of their personal contact information is listed, you can walk through the questionnaire with them. So it's listed here. So let's move to contacts and locations now. And then it's going to be tedious, and this is going to be kind of difficult, I think, at times. And this is where you will have to show empathy and patience. And if they don't have the information or don't want to give it, that's their prerogative. But all we can do is try to elicit that from them so that we can do our part in mitigating the spread of this.
And we'll have a thing called hang-ups, and the hang-ups will be an option for them to make a decision if they get hung up. So that'll be there too.
Yeah.
Just procedurally.
And so when I was doing my patient CTS, I was literally just texting back and forth with the patient. I presume that any method of communication, just so we get the information, is acceptable, right?
Yeah, exactly.
100% accurate.
Yeah. And again, like I said, if it were me, I would take 10 minutes of your time and I'd say, oh, this is great, thank you, I'll fill it out. And you wouldn't need to work with me. And others may want you to work with them up to a certain point. They may get tired and say, I'll finish this later, and that's okay, because any information that's in there goes into our data bank, and we can start working on contacting their contacts that they've been in contact with. So anything is better than nothing. Be sure at the end.
I'm sorry.
No, I was just going to say, just at the end, just be sure that you ask them if they have any questions or concerns.
Okay.
Make sure that they're, that they somehow feel supported. They can reach out to Team Larkin, and then of course thank them for taking the time. So I am going to put this on the chat here. Or is there another way for me to get this distributed to everybody?
Can you put it on the Telegram chat?
I'm sorry?
Can you send the link to the Telegram chat?
Yeah, I'll do it in the Telegram, and I'll see if I can put it on here. But so for this, is there any comments or questions at this point?
Yeah, so there are a couple of people saying that they don't answer, numbers that they don't know. So we might be facing the same problems. What do you have to say about that?
Yeah, that's something that those are things that once we get into this, we're going to have to figure that out. You're right. A lot of people don't answer calls that I don't have an answer for that.
I'm sorry, can you repeat that question, please?
So people don't answer unknown numbers. What do we do about that?
You could send a you can send a text to that number saying I'll be calling you from Larkin Hospital. You know.
I'll figure that out. I'll figure that out by tomorrow.
All right, perfect.
Also, theoretically, these people will have notice of something. Because if we start with the people within Larkin, they will have gotten the initial letter. The initial letter says you've tested positive and here's the ways we can help. One of them is the app. So for our initial, once this goes live, after we test it this week, everybody does what we did last week. We put the WhatsApp or Telegram your questions and we work through those. Once it goes live, it's going to go to people who we have told about this. So they won't be cold calls and they won't be people who are completely unfamiliar. So we'll be able to work out those kinks first.
Yeah.
And then once we get to the people where we're kind of cold calling them because they've come off of a health department list, that's another story. But hopefully as we do this in some type of orderly fashion, we will have addressed all of this.
Okay, yeah. Any other questions about this? So again, Camilo is going to divide everybody into 2 groups. So the first 2 days, you will be a patient, and then the next 2 days, you'll be the CTS. And please go through this, see if it feels comfortable, and any suggestions you can, computer technical questions you can send to Camilo.
And any procedural to make.
Yeah, or and put them on the Telegram if you'd like as well. I think that helps others know that if you've had one problem somebody else has, then it helps us to solve some of the issues.
And just remember, I'm sorry, one more thing. Just remember that there's 2 parts of this. The process, which is Camilo and John, and then the substance and the meat of the questions and how you do things as far as the
Yeah, procedural.
the public health issues.
We are practicing social distancing. Everybody needs to be 6 feet apart.
So somebody needs to mute the phone. But I'm afraid if I say procedural, Sean, then some of this can be looked at as procedural as far as how to get through the app. So I'm trying to do it with regard to process of the computer/app and substance of the questions.
Understood. Okay.
Okay. Does that make sense to everybody?
And if you don't know what your question were, what classification it is, just send it to us and we will respond. We'll deal with the issue.
Yeah, so a quick question, Sean, I know they're going to get to this, but I just wanted to read out Stella's question on the chart about certified medical interpreters, for all the languages. I know you're thinking through the process, but I just wanted to, bring that up.
Okay, go ahead.
Yeah, she was just asking about medical interpreters. Or are we going to refer to another CTS that speaks a certain language? For instance, we'll call up someone and we don't know, maybe they are Creole speakers or Spanish speaker, but we just call them up thinking they're English speaker, right? And suddenly they speak another language, the process. But I know it's something you're going to think through.
Well, at the CDC and HHS, we have an interpreter line. So let me get that line on the manual, and then we'll use that in case they need interpretation. Because majority of these cases in tracking, you're going to say English. Even that one word, just saying English, they know you're trying to communicate. They say no, and then you can say what language, or and then they'll say Haitian, or they'll speak in their language, and we'll identify it and then get the CDC or HHS's or HRSA's interpreter.
Okay, so if I understand correctly, we're going to be leveraging the CDC language interpreters if our CTS.
Yeah,
they transfer them to a CDC line or something?
It's a HRSA grant. It's a program that HHS has that allows anybody doing something like this to tap into it. You just have to, I think you have to register, but I'll call them tonight or tomorrow.
Awesome, thank you.
So I just downloaded onto the chat here that patient script. So you can, I guess, download to your device and then I will put it onto the Telegram as well. Okay. Any other questions about the app or what we're doing next? What we're doing for the rest of this week on trying it out?
No, we
I'm
don't have
good.
any questions.
Okay, Dr. Rana, I think that you have a poll for us. Is that right?
Yeah, Dr. Michelle has it, and I'm gonna run it.
So
Dr.
we're
Michelle.
just trying to find out a little bit more about what the makeup of our team is, and we get an idea of where people are and what profession they're from. Because I think we have quite a diverse team. We've got a large team, and we are interested to know where everybody is and who people are.
Okay, do you guys see something on your screens?
Yep.
All right, guys, so we need to fill up these poll questions just to find out more about each other. So do you guys see all the questions together, or do you guys see question number 1?
I have a question real quick. For our factions in Pakistan and India, do they have medical students that are going to be doing this as well? Because if so, we need to put that on I would put that in the question. Because it says IMGs there, but I know that there was a couple of people working from their country on this, right?
Yes, there are medical students. That's correct.
So I have filled out the 9 questions, but it won't let me submit.
Likewise.
So the option IMG is for the US and non-US both for the first question.
Yes, that will be it.
You have to put an option for every single question, and then it will allow you to submit.
Yeah, let's see. No.
So on
But
the
I
work
already
permit, that's,
mentioned.
Okay, I think I have to. Okay,
I was able to submit. I mean, some of the things didn't apply to me, but I still had to click because I don't know what zone I am. So I had to click a zone, and then it allowed me to hit submit.
That's right. There were some
But I already mentioned I am in US, but it still asks if you are outside what country you belong to. I couldn't answer that question.
I just put other. I just put other on that.
Yeah.
Yeah. Oh, quick. So zone is equal to the same thing as region. So just yeah.
A good job today, guys, while everybody's doing that. I hope that everybody sees that it's coming together and that the pieces are finally the puzzle's becoming more obvious now. And it's taken a lot of work from a lot of people, including all of you. So thank you, thank you. This is a big week, again, for testing the second part of this. So thank you very much.
I can get nothing except the first question.
Scroll down.
Yeah, there's a scroll on the right.
There's a scroll on the right.
So for international medical students, just use for question number 1, use neither of the above for now. If you go way to.
So I just submit all the questionnaire, the poll.
Okay, awesome. If you guys are done submitting, we'll just wait for the results in the next 5 minutes.
Dr. Wright.
All right, it's Dr. Sean. I got to go through TSA. I'll call you. I'll get back on in a second.
Okay, bye.
Yeah, safe travels, Sean. Enjoy Miami.
And you'll just post the results on the Telegram for us?
No, actually, we can see them now. Dr. Rana, can you, because my computer froze on the other side. Can you get the poll results out?
Yeah. Can I end the poll? I'm just waiting for people to respond. That's it.
Yeah, wait till you end it and then you post it.
Yeah.
How many responses do you have?
Mine won't submit.
I think it's almost done. Like 67% have voted for now. 49 people out of 73.
Give it a couple more minutes.
Okay.
And if you can't submit, just go back and answer a question you didn't answer. There has to be an answer for every question in order to submit.
Aha. Thank you.
Please unmute yourself when you're talking. I muted everyone, Dr. Michelle. I'm sorry. Could you unmute yourself?
Yeah, how many you have so far?
Okay. 56 out of the 73 people.
Anybody else was still working on it? Nancy, you're muted.
I'm trying.
Okay, no problem. We'll give you time. Farhana says she can't submit.
Very easily.
The key
I
is,
think it's a computer. It might be a computer issue in some of the cases because I'm actually on two computers. One of them froze, so that I had to move to this computer.
I can't get it to scroll easily.
Yeah, it's not easy. It depends on what system you have.
And I keep trying and it's not picking up the.
Nancy, can you try on the phone? It
Try
goes,
to press the
it goes
down
faster.
arrow on your keyboard. That might help.
What?
Try to press the down arrow on the keyboard and that should help.
Or if you're using a mouse, try to use the scroll button.
Not affecting it. Let me try this. Okay. Well, some of these things don't apply to me.
Yeah, then
If
don't
I'm not
you don't.
foreign,
Yeah, then yeah.
so I can't fill them all out.
Click other. Just
But you
click
will
other.
have to click something even if it doesn't apply to you, or else it won't let you submit.
All right.
It'll be interesting.
Definitely will be.
Good. All right. Anybody else waiting?
It's 57 out of 72. Can we end it?
Is it okay to end it? End it, or you guys just don't? Claire, can't hear you. You're still muted, Claire.
Where's the questionnaire that we're supposed to be filling out? Where is it?
It
I
should
don't
be
see it.
have popped out on your screen. Didn't pop out?
Oh, no, it didn't.
Yeah, it depends on the computer system, unfortunately.
Oh, okay.
All right, so let's see. So we have 67, you said, out of 70.
57.
Okay, let's take a look.
All right. I'll just end the poll.
Now you can post results.
Okay.
Okay, so 53% are international graduates. That's interesting. And then 9% are U.S. students and 4% are DO students. And 35% are neither. A lot of females, 70% to 32%. Of course, we knew Zoom 4 would be the biggest one, and then most people are in the U.S., but we have some people in Canada and Central America and Asia. India seems to me the biggest country, 2%. And that's interesting that 42% don't have a work permit. So that when it comes back to if you ever need to work for government, so that's something to consider.
Yeah, but I put no for work permit. Because
okay.
Right, so I think there's a lot of people who live here that don't need one.
Oh, okay, got it.
Dr. Michelle, I wasn't able to fill this in. I have a work permit.
I love the youth of this group.
Yeah,
70% are under 40.
Yeah. Yeah.
80%.
Hey, we're the minority here. Look at us. We're like 5%.
That's you and me.
Yeah.
Let's not get ugly.
We are proud of it.
Look at the degrees though. Everybody's either a college graduate, master's degree, doctorate degree. Wow. A lot of healthcare, a lot of some IT. That's great. Well, good poll. Gives us a little insight into our group.
You know, in order to attract more males, maybe we need to have Randy the Riveter up there.
Yeah, I think that's what it was.
Okay, any closing comments? Great, I have posted in the Telegram and here the script for you all, and we'll look forward to your comments in the coming days, and we'll meet here next week, same place, same time, right?
Thanks, everybody. Remember, get 3 people.
Excuse me,
And team.
related
Questions?
go ahead.
Tomorrow's meetings and Wednesday's meetings, is it the same meeting code? We have regions 1 to 5 tomorrow, and then the other regions on Wednesday?
Who sent those invites? Have they been sent out yet?
No.
No.
Okay, so I'll work on them later. No, it's a different meeting code. I'll send it to. I'll put it on the Telegram.
Perfect. Thank you.
Yeah, I have to do that. Okay.
Thank you, guys. Thank you, everyone.
Thank you, everybody.
Thanks, everybody.
Bye.
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 Bye, everybody.
Bye bye.
Bye-bye.